Good evening, folks. Hope everyone is doing well. My name is Brian Jefferson, President of Chapter 94 Mended Hearts. I'd like to welcome everyone to our February support group meeting. Today we have a special guest, Dr. Marlys Rixey from Suburban Hospital. She's going to talk to us today about some of the emotional and mental aspects of our heart events. Okay, but first let me say, this is going to be recorded. Your likeness and or voice may be used on this or one of our other platforms. So if you do not want to be visible, please turn your cameras off. But your voice will be used. Karen, would you introduce our guest?
Thank you, Brian. Hello, everyone. I'm Karen Bertozzi. I'm the Secretary of Chapter 94 of Mended Hearts. And I'm so excited that you have decided to carve out some time to be with us tonight. This is going to be a very informative Mended Hearts meeting. We are discussing the mind-body connection in heart disease, and I'm thrilled to introduce my friend, Dr. Marlys Rixey. I first met Marlys almost 10 years ago after going through emergent open heart surgery and the subsequent cardiac rehab that followed. Marlys helped me with emotional healing after going through what we all know is such a traumatic time. She also offered emotional support to me when I lost my brother to heart disease almost 6 years ago. She's directly involved with patients participating in the outpatient cardiac rehab program at Suburban Hospital. She is the behavioral health therapist on staff. She counsels patients who are living with heart disease or recovering from cardiac medical procedures. She provides extensive mind-body stress management tools for her patients and their families as they move through health and healing after receiving a cardiac diagnosis. Marlys is a mind-body psychotherapist and life coach with over 30 years of private practice. She has her doctorate in psychology, and for me, the most important part is she has a focus on behavioral cardiology. Please help me welcome my friend Marlys.
Thank you, Karen. It's an honor and a pleasure to be here. When Karen asked me to present, when I'm talking to a group of colleagues and patients, you are all at very different stages in your recovery, and I did not want to make any assumptions in terms of people that were 3 months out of a cardiac event or 3 years or 10 years out of a cardiac event. And because of that, what I'd like to do is start and just in a general way, talk a little bit about the work that I do and the different areas that I think are important to focus on. And then I'm going to open it up to everyone here that has joined us to see what direction, what you want more information about. And I can talk about a lot of different things. So I thought I'd leave it up to you all to decide where we want this conversation to go. So it's going to be more of a conversation than a lecture. So as Karen said, I've been working in behavioral cardiology for most of my adult career. I've done a lot of teaching in terms of cardiac patients coming together where stress was a risk factor, and teaching a 6 to 12 week mindfulness stress management class, which includes learning specific techniques, mind-body techniques, as well as learning about the physiology of stress, how it affects the heart, our emotions, how our emotions affect our heart, and cognitive behavioral techniques to turn those around. When I first see patients individually, I work in phase 2, so they're right out of surgery or their event when they come into the cardiac rehab program at Suburban. And so when I see them, the first thing I focus on is I tell them that I wear 2 hats. The first is that I want to get a sense of just how they're doing in general with the diagnosis of heart disease. For some people, they've been living with it for a while and it was expected. Other people, it came out of the blue. They had no idea what had happened to them, and they were still in a place of shock. We have patients from the 20s to the 90s. So there's no age, the age span goes across. We've seen younger and younger patients because of various reasons that I'll go into in a minute. But when I talk about how they're coping, it's sort of, as you all know, having a diagnosis of heart disease is life-changing. The diagnosis of either cancer or heart disease in our culture are the two most life-changing diagnoses that people can get. And that changes everything. It changes your relationship to yourself, to your family, to your community, to your work. And that can be pretty overwhelming. And my job is to help sort that out in terms of how to navigate this new diagnosis and what it means to you in your life. I also look at what their risk factors are, and the one risk factor that we have no control over is family history. But they can give medications for that. Many of the risk factors for heart disease are behavioral, and we look at how we can work with them to change those behaviors from perhaps just having a sedentary lifestyle to being more active. And I also look at the response to heart disease on an emotional level in terms of primarily anxiety and depression. Those are the two primary emotions that affect people. And if it's the first time they've experienced those, and what that's like, some people that have never had a strong emotional response might find themselves having a panic attack and not knowing what that is for the first time. So I address how to deal with anxiety, how to work with depression. The important thing is that having an emotional response is 100% expected and normal. If someone says to me, I'm fine, there's been no problem, everything is hunky-dory, I'm just continuing to live my life, I don't buy that. It's too much of a life-changing event to not affect somebody on some level, on an emotional level. And sometimes it's important to very gently talk about how those emotions come up. It can affect their sleep. We work a lot with sleep as the foundation for health. We also look at these nutrition and diet as a risk factor. Smoking, not so much anymore. Smoking has really gone down in over the last few decades. It used to be a primary risk factor. But those who are still smoking, it can be a very difficult transition to become a non-smoker. I've had patients who said my last cigarette was the day I had my heart attack, and that was it. And other people struggle more with that. So we look at all those different types of emotional responses, and how it changes our sense of self. Coming to terms with that. One of the things that I think is important that we might want to talk about a little later is the ability to tell your story and a place to share your story with yourself or with somebody else, whether that's verbalizing it to someone or actually writing it down. those patients that I have that are writers, I encourage to write their story. Writing is one of the most profound techniques, tools, exercises that you can do to make sense of a trauma in your life. And so I do a lot of writing with my patients. The other element that I think is important to look at in terms of the emotional responses is the element of loss. And I speak about loss as a process that you go through after experiencing a sense of loss. And why this is important is because a lot of times after you've had a procedure or a diagnosis or a heart event on some level, and you're discharged, the physician or surgeon may look at you and say, "You're great. We fixed you. Go back and do whatever you want to do. Live your life," right? And but what happens internally is that you don't feel the same way. So how can you possibly move forward and get back to how you used to live your life when everything has changed in your worldview? And part of that is that sense of loss that we have. Some people have a physical loss. They can't do what they used to do. They have to change jobs, quit jobs. They can't do the activities they used to do. So there's a physical loss, but there's also a loss of health in general. Even though you're considered healthy, you've had a sense of loss with your health. And because of that, what we know about loss is that you go through pretty specific stages of loss. And those include the two primary emotions of both anger and sadness. And anger, unprocessed, can turn to rage, which is a primary risk factor for a second heart attack. And sadness can turn into depression, which can be a serious illness and also be a risk factor for heart disease moving forward. So we talk about that and the vulnerability and that sense of loss. For some people, the loss is food. Having to change their diet so dramatically in terms of how they've eaten their whole life that's all they can focus on is what they can't eat. I had a patient who was a total foodie and lived for food and cooking and going to restaurants and traveling the world in his work. And his greatest pleasure was going into restaurants and talking to the chefs and experimenting. And when he was told that the majority of his diet had to be changed, he went through a profound depression, profound sense of loss. And we worked really hard on how to turn that around so that he was not devastated in terms of never being able to eat some of the things he could. And he turned into an extraordinary chef, a heart healthy chef, and shared recipes with friends and would have dinner parties and want people to know all the healthy ingredients in that. But it took a while. It took a while to process that sense of loss that he had. So that's, and in stress, in managing stress as a risk factor, I work with, again, the mind body, do a lot of relaxation techniques. Many of you are probably very aware of relaxation, meditation, and as well as movement in terms of yoga, tai chi, and qigong, which are all movement meditations. Anything that and or even just walking meditation. In terms of mindfulness, you can turn any activity into a mindful activity. So that's sort of a general overview of the areas that I focus on in my work. And now I'd like to see where people's interests are in terms of what you'd like me to speak more directly towards.
Question. Even though we may have had these events years ago, sometimes we still struggle with them 5, 10, 15 years later, maybe on your anniversary date or, certain things that remind you of your heart event. Is there some type of, I guess, exercise or something you may recommend to kind of get you through with it, to kind of be able, not so much
Right,
to let it go, but not to let it be so, to
right,
manifest itself so promptly later on?
right. That's a great question. What I refer to as triggers. What can trigger you is it's very close to re-experiencing what you went through. And anniversaries are huge. The first anniversary of an event is a profoundly effective in terms of where you were a year ago, right? And a lot of times just the awareness of recognizing what happened a year ago. A lot of times I will talk to people and they say, give me a timeline, give me a timeline. And depending on the trauma level of their experience, I will look at 6 to 8 months, 8 to 10 months. I like to give everybody a 1 year. I say, look at it as 1 year, but you might feel 99% after 8 months. And then it might take another, 3 or 4 months for that last to feel really good. But then you're coming up on the anniversary. And what the majority of people do on their first anniversary is regress and go back to the feelings that they had of panic, fear, loss, anger, all those. But if you know that beforehand, that, oh, it's coming up to that time, and these are the feelings I recognize them, it's normal, I'm expecting it. Okay, and then mindfully just being able to move through that. Triggers can also be activities, and such as snow and shoveling snow. One of the first things that I tell people, and when they're asking about what their life will be like moving forward, and I say, the one activity that you will never, ever do again in your life. There's one activity you should never do again, and that is shoveling snow. Okay. The ER is full of cardiac events after a snowstorm. And so I sometimes will get pushback about that. But it's threefold. When you're shoveling snow, you have it's an isometric, you're lifting, that's putting pressure on the heart. It's cold air outside, that's constricting your airflow and your capillaries from the cold air. And for most people, they're on an incline. And if you've ever been on a treadmill and you just change your incline 1 or 2 degrees, you know how it can change your numbers. So that's 3 strikes. And is that worth it? And so, but because of that, every snowstorm might be a trigger for you, right? Or if you were on an airplane, or if you were on vacation, or wherever it happened, wherever your event happened, it could be years, but every time you are in that general, either area or doing something, and it will bring you back there. So the tools are really just understanding and awareness and sitting with it. In mindfulness, we talk about the ability to just sit with an emotion and say, that was really scary. That's fear. That was really scary. Yeah, it was. You don't have to do anything about it, but the ability to just sit with it and allow the emotion to go through. Emotions only last a few seconds. Okay, it's our thoughts that keep the emotions going.
Great response. One of the reasons I asked, today is actually my 11th anniversary of it.
Ah, wow.
So it was kind of like
Congratulations.
a bittersweet kind of day so far. I
Yes.
mean, but you know, still had some emotions some mornings when you wake up, but all in all, I'm doing pretty good. I can't complain.
Good. Yeah, and sometimes just using that, like you say, as a celebration. Look how far you've come in 11 years. Look at the changes you've made. We talk about gratitude, the element of the technique of gratitude, and all the things that you're grateful for. Some people say that it changes their life for the better. They appreciate things they've never appreciated before. And each year to grow on that. So the gratitude exercise is a lovely exercise to do on an anniversary. So thank you for that.
Mhm.
I have a question.
Yes.
I've seen counselors my whole life. The current counselor I'm with, I've been with him for 15 years. After the incident with me, which was in September, I just don't feel like he understands. So I tried another counselor through the hospital, and she gave me the same exact advice that my counselor has given, which is basically just get through it. Well, this isn't my first medical rodeo. I've been through many different life-threatening medical events, and I was fine until Christmas. I mean, I just was putting one foot in front of the other and getting through it. And Christmas came, and I went into a tailspin. And nobody seems to be giving me any advice to get me out of this tailspin. I do a lot of work. I do a lot of charity work. I'm in the public. I do things. I even got a dog, you know, but I'm still not coming out of this tailspin. And I'm not getting any good advice. So how do I find good advice?
Well, I don't have any magic for you.
Right.
I think reaching out to people, what you're doing in terms of reaching out to different therapists and different organizations like Mended Hearts and getting as much information. Since your event was fairly recent in September, we're just talking a few months, you're still processing the intensity of that. And as we said with Brian, in terms of anniversaries, the holidays are a huge trigger for people. Okay, they're a trigger for people that don't have medical illness, but holidays, tomorrow's Valentine's Day. I mean, think about the symbolism of the heart with Valentine's Day. So what you're experiencing with all these emotions that are coming up, it's not so much what you need to do as much as your therapist just being able to sit with you and listen to you process what you're going through. And I know that I know that we like things to do, right? Tell me what to do. And, what to do may be, again, depending on the risk factors, what the risk factors were. It might be to not be so sedentary. Sounds like you're social and you give back to the community and you've gotten a pet. Those check. Those are all positives that you're already doing. But part of it is just allowing yourself the time to heal, going through all
My
this.
doctors keep telling me that, but that's very hard. And like I said, this is not my first rodeo.
Yeah.
It's just like, come on, it's 4 months. Let's get on with this. I have life. Come on.
4 months, I should be back on the horse, right?
Right.
And Yeah, unfortunately, our timeline is different than our healing body mind timeline is different than our cognitive timeline. You know, especially in our culture. Our culture expects us to get back immediately, right? And 4 months is not a long time. It's not a long time, but it doesn't mean that you don't still have stuff to talk about with your therapist. And just knowing that the more that you talk, the better you will get.
Thank you.
You're welcome.
Marlys, I just wanted to jump in. I know one of the things that's been helpful for me over the years is a sense of humor. And one thing that you just mentioned is with Valentine's sort of being a trigger. And I know, so I had an aortic aneurysm and dissection. That's what sort of transitioned me into a cardiac patient. But I can't go anywhere right now without there being open your heart, open your heart, open your heart, open your, and my heart opened. So talk about a trigger. It doesn't matter if I'm at Giant or at the hospital or
Right.
watching a commercial. And you know, that's just a lot for me. That's a trigger for sure, even 10 years out at this point.
Yes. Yeah. Yeah. The symbolism of the heart in all cultures is, you know, it's the center of emotion.
Right.
And so when you're talking about open heart and the center of emotion, and it's been broken,
Mm-hmm.
right? And how do you heal that? Again, there's no magic in anything I can say, except that the heart is extraordinarily strong. You know, one of the things that I think is sort of amazing when people are able to see and understand what happened with their heart, and they say, you know, I had a blockage, but but the part that was blocked, the body created tributaries around the blockage, sort of like, you know, a river that is blocked, and all of a sudden you'll find these little tributaries that go around the blockage. You know, the body wants to heal. We know that it's called homeostasis, and the body's natural place is to be healthy. So, like if somebody has smoked a pack of cigarettes a day for 20 years, and there's no disease in the lungs, they've just smoked for that amount of time, and there's an incredible amount of tar and nicotine and gunk in their lungs. And then they stop smoking. The body will immediately begin to purge. They'll start coughing and you know, and I'm can't quite remember my timeline, but it's something like just over a year, like 13 months after you stop smoking, the lungs will have cleansed themselves like up to 90%, because you've given it the environment to heal. So the body wants to heal itself. We have to give it that environment to heal, and that environment is a balance of managing your stress, you know, the movement and the emotions, which, you know, can cause everything. It's physical stress, but also emotional stress. The other example I use is that of a salamander. If you have a salamander and you cut off its tail, the tail will grow back. But if you take a salamander and you cut off its tail and you put it in a stressful environment, it will not regenerate its tail. Okay. The organism needs the proper environment to heal. And so when we look at stress, that proper environment is the balance of how much movement and exercise do you do, and how do you balance it with the parasympathetic nervous system, which is the branch in the nervous system that we call the healing branch. And that healing branch is naturally occurs twice every 24 hours, which is a conscious, relaxed state. So you naturally go into it as you're falling asleep and then as you're waking in the morning. But most people wake up with an alarm clock, or they have a hard time falling asleep, or they have taking so many medications, it disrupts the normal sleep cycle. So our body's missing that natural balance that we used to have in terms of being up, awake, good stress, being active during the day, and then that twilight state, falling asleep and coming out with a solid night's sleep. Then the body's balanced. Now we have to join a gym to get the exercise because we're so sedentary, right? And we have to learn relaxation to engage that parasympathetic response, because it's all about the balance, so that the body can then heal itself from whatever cardiac event you experienced. Other question?
Yes. My heart event was almost 14 years ago, and I truly believe I'm doing fine. Actually, one of the things that you said, which I don't remember ever being told, was never to shovel snow. I don't think I've ever heard that before.
I know. Yeah, it's my personal soapbox.
Okay, but fortunately, I have wonderful neighbors who, even if I pick up a snow shovel, they get on me.
Good.
So they take
Good.
care of me.
That's the
So,
kind of community I like to hear.
yes, yes. So I don't really have to worry about that. The other thing, when you were talking about food, and this is one of the things that I still struggle with, because I'd be like, why can't I eat what I want to eat? That chef that you were talking about, is he still sharing recipes?
I think just with friends, he's not publishing.
Oh,
But primarily, the American Heart Association pretty much comes out with the Mediterranean diet as being sort of the long-term healthy diet. It's not terribly restrictive in terms of, you never eat meat again, never, it's like certain diets, and we know that diets don't work long term. But if you can embrace sort of the Mediterranean concept, and again, it's just like exercise. Whatever you do most of the time, your body will adapt to, right? It doesn't mean that if you want to celebrate Valentine's Day tomorrow, you have a special meal. Go for it, right? Because most of the time you're eating well. And the same with exercise. Most of the days you're active, trying to do, something, even if it's just standing up and not sitting, standing up every 30 minutes or 45 minutes. Whatever it is, most of the time is how your body will adapt.
another question. How do you get people to understand that you are fine, even after all these years? There are some people who say, oh, you shouldn't be doing that. Don't do that. And let me help you. No, you go sit down. And I tell them that you're not at home with me, and I have to do these things at home. So why not let me do them where I am? I'm not going to do anything that's going to jeopardize my health.
That's interesting, because a lot of times we see that with caretakers, that especially right after an event, the people that are in your immediate circle have to step up, because you need help and support immediately afterwards. And then, depending on your personal circumstances, as you get stronger and it's important for you to do things like lifting groceries. You may never lift, more than a 10-pound bag of groceries ever again, right? You don't That's just your limit. That's knowing what your limits are, right? But getting up and clearing the table, that's different. And so caretakers have, we talk about this a lot, is like, it's hard for them to turn around and not jump in and see that they need, that you need them or something. So depending on where they are in your focus, close family, close friends, as opposed to just, people in your community that see you. And because remember that when you've undergone a hard event, it affects everybody in your life. And the fear that you experienced, and we see this with adult children, that sense of loss. They almost lost a loved one. And so their own fear may not be, they might not have processed it as quickly as you did. I think you said it's been several years though, correct? Yeah, that might just be good-hearted people that like to help you. Which can be
They
very
are,
different
they are.
in caretaking and people around. Just allow them to love you.
Yes.
Hey, Marlys, is pushing snow and shoveling snow the same thing? I definitely have a hard time with if it snows not to go do
Right.
something, but I do it
Yeah.
maybe.
This is where I get a little pushback is what if I have a snow blower? What if I'm pushing it? And I said, well, if you can sweep it with the broom, if we were in the Rockies, you could just go out and sweep the snow with the broom. But we have pretty wet, heavy snow in the East Coast. And so that's weightlifting.
If I can't push it, I'm not moving it.
Okay. All right. So then you
Okay.
just have to look at how much cold air you're breathing in, because that's going to constrict your vessels, and how much of an incline.
It's only 5 to 10 minutes at a time. It's just something to.
Yeah. Sometimes I tell people if they don't have a choice or they're just they really enjoy being outside, say wear a muffler, take a break, do things like that. But really that isometric of the pushing and the lifting of heavy snow is incredibly constricting.
I got one more question.
Uh-huh.
I know a lot of people, once they have the event, everything's taken away from them in the beginning. And they have a problem by trying to fill every available minute or space that we had because we think that we kind of missed something. At what point do we need to stop and just maybe deal with the mental healing part versus because we don't want to think about it, and it only kind of kicks the can down the road a little bit. At what point do we need to stop filling up our plates and just deal with our emotions and deal with whatever it is
Right.
that has happened?
Right. And sometimes I'll look at that in terms of denial, and if you're really not addressing something, and what's behind that, what is, there's a fear behind that. I think sitting with our emotions is incredibly intimidating if you've never done it before. And we are a culture that have been taught and lives on doing more and more. I talked to somebody who used to brag about how much they could multitask. You know how many things I can do? I can be and do this and this and this. And the brain actually can't multitask at all. It just means you're doing a lot of different things, but not well at all. And distraction, a lot of times that works for distraction. And so one of the things when you talk about overcompensating is, if I stay distracted enough, I won't have to sit with my feelings. Is that kind of what you're saying?
Yeah, I mean, I understand. I got your answer. Okay.
Okay, yeah,
I never had a problem with just dealing with whatever emotion came, because
right,
you had to deal with it in order to heal, in order to get better. So
right,
you can't move forward if you keep not dealing with it. I
right.
may feel better, but emotionally, I may not be ready to do this, that, the other thing, but you still got to deal with it at some point in time.
Right. And one of the things that I like, Brian, to suggest about something like that when I went back to writing is a lot of times with our brain and our emotions and the cognitive elements that go in, people say there's so many around and around and around. I'm like, hey, let's write them down. They went, actually, there were only 3. But they kept going around and around and around. But it was the 3 thoughts or the 3 emotions that kept going in what we call a whirling mind, right? So sometimes when you write them down and you see them, just say, okay, yeah, I see that one. I identify with that. Oh, there it is again. Oh, there it is again. In mindfulness meditation, one of the things that we do is we recognize, we observe what's coming up and label it. And when it comes to emotions, once you label an emotion, it changes it from the part of our brain which is based, the emotional part of our brain called the amygdala, it shifts it from that to the prefrontal cognitive part of our brain, our thinking brain, our higher developed brain, just by giving it a label. So if you say, that's really scary, that's a fearful thought, just the ability to be able to put a label on that shifts it from an emotional response to a cognitive response. And then you can problem solve it, right? What do I do about that? Nothing, or is there something that you can problem solve? So in mindfulness, I call it observe, label, release. You're observing what's coming up. You're observing that emotion. You're observing that thought, that whirling mind thought. And you give it a label. When I first started doing this, I thought, oh my God, all I do is, my brain is just planning. I'm always planning. I'm always in the future. I'm just planning this. What am I going to do tomorrow? What am I going to do? I'm making these lists and planning. And I was like, what a waste of time. All I need to do is make my list, my to-do list, and then I can let go of that, right? There was so much time that my brain was in that whirlwind of planning. And other people, it's something different, but most of us don't have 10, 24 thoughts. Most of us have just a few. So that's where the writing and the mindfulness can help to sort of calm those emotions. And sometimes it's sort of like, I need to address this. I need to get some help with figuring this one out.
Doctor, I have several questions, if you don't mind, if we have time.
Mm-hmm. Sure.
The first 2, Kevin Farley and I were both accredited visitors down here in Williamsburg, Virginia, chapter 427. So I have 3 questions, but the first 2 are really about, and Kevin, please feel free to jump in here. 2 of the things that I run across very frequently when I'm visiting: paranoia and fatigue. So I'd like your advice on that. So the paranoia question, so many patients will say, how do I know this will never happen again? I take my cell phone into the shower because I'm afraid I'm going to have another event. That's the paranoia part. And actually, sometimes when that happens, I actually talk about your point to homeostasis.
Mm-hmm.
Because I say the farther out you get from your event, the better off you are, because your body wants to become stabilized.
Mm-hmm.
But I'd love your advice on that. And then the fatigue. We find fatigue, patients struggle with fatigue after their events.
Mhm.
And it's not just physical, it's emotionally draining.
Right.
So do you mind speaking to those 2 points? And then the third part of my question is something more personal.
Um, I'm not sure that paranoia is the most productive label
Okay.
to use. I think a concern, um, they can have a fearful response and a concern because that's legitimate. It's legitimate in terms of how do I know something won't happen again? We don't.
Right.
We don't. We do everything that we can do to make our bodies and our minds as healthy as can be, and then you get to that place of acceptance, right? So that's the cognitive part of it. The healing part of it is a lot of times, again, in our culture, we're a culture that's pretty cut off from our body. We're a very head oriented body, and so a lot of the mind body work is getting in touch with our body by, again, the mindfulness of how you're feeling, recognizing feelings, but also Karen teaches cardiac yoga, and one of the elements in yoga is what we call a body scan in mindfulness meditation. And it's really just going through your body and saying, oh, there's tension in my jaw. Oh, my throat is a little constricted. Oh, my stomach is tight. Oh, my hands are clenched, right? Going through the body and just recognizing the different areas of your body and then being able to learn to relax them. There's my heart. My heart is pounding. Oh, I'm in AFib. Okay, I recognize that. What can I do? What are the techniques of breath work and relaxation that I can do this? The more in touch with your body that you are, then you're increasing your body intelligence, so that if your body were to develop another blockage, you'd start to feel it. Just say, you know what, I'm feeling different than I have been. Over the last few days or weeks, I'm a little short of breath. I'm feeling some sensations I haven't felt before. They might be very subtle, but because you're paying attention to your body and you notice that gives you the confidence that when you get up and you get into the shower, you say, I'm feeling good today. I'm feeling good. So the paranoia is, that's a protective mechanism, right? And it may be I'm not feeling well. And is that paranoia? No, that's paying attention to your body. So I would reframe it a little bit in terms of concern about what you can do, or what more can you do in order to feel confident about how your body feels. Your second question was, what was it? Paranoia?
Fatigue.
Oh, fatigue. Yeah. We know that up to a year after surgery, fatigue is just a physiological reality. And I was talking to somebody today who said, when I was talking about sleep, and I said, what about rest? Do you take a nap? And he said, oh, I try not to. He said, my wife gets very upset if I take a nap. And I said, actually, your body needs a nap. You've just had open heart surgery, right? Your body's in an active healing. You need more than your nightly sleep. Okay, you're in rehab, so you're pushing your body, you're exercising more. In the afternoon, you need that rest, you need that nap, because that some of them will say, I can barely make it home after I've exercised because I'm so fatigued.
Mm-hmm.
And that is that reality. If it lasts more than a year and you're doing all the right things in terms of adequate sleep, adequate movement, stimulation, intellectual stimulation, rest. And there's still an element of fatigue that's maybe more of a medical issue.
Marlys, if I could just jump in, I'm not a physician or anything, but as you well know, I'm assuming, Diane, I don't know your cardiac story, but when after my surgery, I went home with 16 prescriptions. So there's a lot that's happening, I think, on that level too. Meds that can make you fatigued, and it's just a whole different ball game. And I'm sure you know that, Diane. And but even as you wean off the medications, there are still some medications that do kind of add some fatigue to our systems, in my opinion, in my experience.
Yeah, no, that's absolutely correct.
Yeah.
Mhm. Definitely. Yeah. Beta blockers was one of them.
Absolutely.
Yeah.
Yeah.
Okay, great. Now the third question is more of a personal thing. I had open heart 5 years ago, and it changed my thoughts on mortality greatly. I'm fairly spiritual, but when you were talking about how adult children feel like the loss, that they almost lost their parents, could you speak to that a little bit? Like how a heart event might change a person's feelings or thoughts on mortality?
Yes. After we sort of go through more the basics, then I go into what I call the existential elements of the healing. And anyone who has gone through and has a diagnosis of heart disease is going to have thought about death. And the difference between cancer and heart disease is most people that have that diagnosis at some point will say, well, it might not be for decades, but cancer will probably take me out, or heart disease will probably take me out at the end of my life, right? The difference is that with cancer, you have time, and with heart disease, you don't. And so it's important that we look and talk about how they feel about death and how they feel about their life. That's that whole change in perspective in terms of you will never be the same, because you know that you've already faced death, right? Now 5 years on, you're in a different place than you were 5 weeks or even 5 months after your surgery, when it was right here. But I think in terms of existential crises, I think that's a powerful and important place to allow yourself to spend, in terms of thinking about, for some people, it's sort of like, well, I just need to get my papers in order. I need to get my papers in order. Or for my surviving spouse, I want to make sure that everything will be okay if something happens to me suddenly. And that's sort of on a physical level, but like you say, on a more spiritual level, it's how you feel about the end of life, and how you want to spend that time. I find that people after heart disease, after a heart event, embrace life differently than most people that have never had, any issues, right? It's because you've looked at it differently. You've faced stuff. I was talking to a patient last week who said she came out of surgery, and the physician said, the surgeon said, well, we didn't think you were going to make it. We thought you were going to die. Now, number one, I think that surgeon should have lost his license. But to have somebody say that to you when you're still in the hospital was trauma, right? It was traumatic, and we worked with that. And not that she didn't already recognize how dire her situation was, But here we are 3 months later, and she's in cardiac rehab. She's breaking a sweat. And so, yes, it's a profoundly important question, or not question, but area to sit with people, with yourself, with people that you care about, with adult children, things like that. And with the stages of loss, it's sort of like coming to a place of acceptance, but not without a lot of contemplation. And that's the quietness. And Brian, when you were talking about, being so busy that you didn't allow yourself to have that time for contemplation, that's a powerful time in our day when we can just sit and be and think about the important things in life.
Thank you so much. That was very helpful. Thank you.
Marlys, I just have a question sort of on the tail end of that. You've talked about the stages, sort of, we all move through those stages at a different rate, at a different time, right? In terms of recovering from these events. Like
Right.
some of us, it can take 10 years. Some of us can take 2 years.
Right.
And there's,
Exactly.
and sometimes those stages also can happen out of order, right? It's not.
It's not chronological. It's except for the first one, which is shock. Shock is pretty much across the board for most people. And again, the timeline I work with people is I say, give yourself a year, but then going up to the anniversary, and then it more like 14 months, right? Because you have to pass that anniversary. But up until then, my experience with people with the two emotions of anger and sadness is people tend to be prone more towards one than the other. People tend to either be more on terms of the anger, frustration spectrum, and other people are more towards the sadness and lethargy part of the spectrum. Then you get into the bargaining and denial. And again, a lot of the denial and the bargaining I find comes with a lot of what their losses were. With my patient who was a foodie, it was all around food. Bargaining about, well, I can do this. I just had a good workout, so I can eat this, right? Or it doesn't matter what I'm eating now because I'm taking a pill for cholesterol, so I can eat whatever I want, right? So that bargaining and denial can come in different ways. And then you get into a place of acceptance, especially if you're feeling good and you're saying, I'm exercising, I'm eating right, my numbers are good. I saw my 6-month, my yearly checkup with my cardiologist. He said, looks good, keep on keeping on. And then you might get to a place of acceptance. And then you might wake up and have a trigger. You read an article about somebody that had the same experience, or you talk to a friend, or there's a snowstorm, or there's, an anniversary. And then you're back into the sadness or anger. But again, if you recognize it, some people say, why am I crying when I'm watching an advertisement on TV? I've never cried before, and I burst out into tears when I'm watching an advertisement. Okay. And sometimes that's the only way that we can allow those emotions to come up. And that's fine. I used to, people say, I can't cry, I can't cry. I said, oh, go watch a sad movie. Just cry for somebody else because your body is still purging. The interesting thing about tears is, and this was ages ago, they did this experiment or research, for those of you who are old enough to remember the original Brian song, the story of Brian Piccolo. And when that came out, nobody watched that movie without crying. Nobody. So they did this research where they had these patients watch this movie, and collect their tears. And then they had people that were chopping onions and they collected their tears. And what they found was that the tears of the onion choppers contained salt and water, and the tears for the people that cried out of emotion contained stress chemicals. So when they say a good cry cleanses the soul, right? It's the way for the body to release stress is tears. And so when people cry and they say, "Oh, I'm so sorry," I was like, no, that's the healthiest thing you can do is to cry and have your body purge that. So oh, the other thing is that anybody that is a part of your life and close to you is experiencing loss too, whether it's children, adult children, spouse, family, anybody who's close to you. Nobody goes through them at the same time. If you're frustrated, your partner might be in denial, and then they're angry and you're in a place of acceptance. Okay. And so there's kind of this ping-ponging going back and forth. You could have one emotion in the morning and another emotion later in the day. Again, and then you get to a place of acceptance for maybe a couple weeks. Who knows? And then something will come up. But if you recognize that all these are part of the processing of of the trauma that you've gone through, then again, mindfully you go, "Oh, okay, there it is. Yeah, I just bit their head off and they deserve that. Where was that coming from? Right, I know where it's coming from. I might need to apologize." Right? So yes, we all go through it at different levels, and you can have weeks in between, uh, and so give yourself a lot of time to process all these.
Hey, I got one more. I went through that whole roller coaster. I checked off most of the stuff you're talking about. Do men or women handle the stress or the emotion one better than the other? Because I mean, men are taught not to show a whole bunch of whatever, but I know after I had
Absolutely.
mine, I cried like a baby sometime, and the whole 9 yards.
Yeah,
But
it's very cultural. It's very cultural. Men are told to, the military, stand up straight, uh, stomach in, chest out, and big boys don't cry,
yeah,
right? And so as a culture, when we're trained for that, and it's part of our training, then it's working against that acculturation, right? And so that's a hard one to overcome. That's why I tell people, watch a sad movie to help you cry, to get in touch with your emotions. Film therapy is a great way to experience different emotions when you go through that. But yes, it's pretty much of a cultural thing, and it's genetic. It's just sort of men and women are different species, right? So, but again, being aware of that, and even if you don't have the tears, just being aware of the feeling of sadness and sitting with it and being okay with it, right? Because women are told just the opposite. How dare you sit in a workplace and be emotional? That's not acceptable in our culture. Women can't be emotional in the workplace. So what do? We clamp it down. So it's kind of part of the stress of kind of swallowing the stress. When you swallow the stress, it goes straight to your heart. Straight to your heart.
and big boys do cry.
Good, good.
Hi,
Good,
this
good
is
question.
Thea. TG, I have a question. A lot of what's been said has touched on a lot for me. Like Brian had mentioned, a lot of it I can identify with. One of the things that I believe her name was Carol that she mentioned was having people not feeling that her therapist understands how she feels. I went through that with my family because I was always very independent, very strong, the fixer for everyone and everything. So when I went through my cardiac event, it's been 3 years now, my family wasn't very accepting that something had actually happened, that I was different in ways that sometimes I didn't quite understand. I became very emotional, which I was always, I could cry, easily, but emotional for things that I couldn't always explain. Very ultra sensitive to things. A lot of what happened with me during my cardiac event, I had no recall. So I felt very insecure about where being alone, especially, where
Mm.
taking risk. It was during the pandemic, so I did cardiac rehab, but there weren't a lot of, as you're doing, the emotional support that I needed to go through it. I didn't want to take my family through that, but there weren't a lot of resources at that time where you could go one-on-one and get support and get help, and people hadn't really connected at the beginning into Zoom and online resources, so I was kind of left hanging by myself.
Right.
But one of the things that I did was, in listening to you, it might have been some denial in it, but I decided where I wanted my focus to be, and that was on moving forward. What happens now, next? Because it was very traumatic in itself, but adding the insecurity of being afraid in my own basement and being afraid to take the trash out, not knowing what I could and couldn't do.
Mhm.
And listening to you all, I still, the weight bearing snow thing, like like Brian and Linda, that's a real surprise to me, because I always like to help my husband with the snow shoveling, so it didn't take as long for everyone. But I don't feel that I even now clearly understand what I can do versus what I shouldn't do, knowing what the restrictions are, especially, the doctor said, "Oh, you're fine. You're healthy. Your heart is strong. You're good." But like you're saying, "Well, you shouldn't shovel snow." I don't know what those other things are that necessarily are, the restrictions on what you kind of sort of probably shouldn't do. I took a nutrition class after my cardiac event and I learned a lot.
Mhm.
It helped me immensely.
Right.
But other than those things like weight bearing, just to hear that now, that brings a question mark in my mind. Well, are there other things that are, not necessarily nutrition related, but are
Right.
there other
Physical.
things with other stress and, you know, fretting and emotion? I get that, but are there other physical things that, because I was told, well, no, you walk, you exercise, you go live your life.
Yeah, I can't answer that specifically, because everybody is different in terms of what their limitations are. But I would ask your cardiologist,
Mhm.
um, specifically, do I have any physical restrictions in terms of, again, with surgery, and they're really looking at a 1 year cycle for strengthening. After 1 year, you may not have any restrictions.
And I did ask, and he said that I didn't. But
Right.
it was just interesting hearing about something that like the snow, that you should never ever do that. And I
I
will
know,
certainly.
I've had discussions with cardiologists about that. And they said, well, there's always exceptions. And I was like, no. Like I say, that's my personal soapbox that I
But
think is not necessary. It's just not worth it. But
is there anything to, I know you said, I was told it's called anticipatory anxiety,
mhm,
and not feeling secure.
right,
Not
right.
necessarily saying, oh, wow, if I go to the giant, something may happen. But
Right.
how do you, after feeling very independent, and after the other side of this is feeling, I don't always feel as secure as I'd like to feel about doing things that I normally did before.
Mhm,
It's
mhm.
not always that way, but I do encounter just not feeling secure.
Right. And I think that again, I would go back to that knowing yourself. The know thyself is when you know what your limitations are, then that anticipatory anxiety will decrease because you said, okay, well, I have to go from here to there and there's so many steps and I'm carrying this, and but I know myself. I know that I'm strong enough to do that. But if you don't know that, then sometimes it's going to the gym and getting, taking a class at a gym in terms of a strengthening class, or
Mhm,
even a weight class. And so that in a protective environment, you can learn what your limitations are. Okay. The anxiety is kind of the unknown. And so it's telling you that you need more information. So seek out that information in
mhm,
whatever area it is, if it's a physical limitation or a dietary limitation or something like that.
mhm. Okay,
Okay.
thank you.
Mhm.
And I would just chime in if I can, Thea. I think, well, one of the things that I'm enjoying so much about this tonight that I think has, well, I know has been super powerful in me over the years is just as Marlys is speaking, so many people are nodding their heads. So I think that's huge. We all are having very similar feelings. And so just knowing that we're not alone and that the anxieties that you're feeling are also experienced by so many of us. And so, Thea, I was just thinking about you, and my event started with fainting in the grocery store, right? But I still have to go to the grocery store. I've got 3 kids, and so you do have to face all those fears. But I would just encourage you, all of you, just stay in touch, find somebody else who's been through it, and I think there's real power and support in sharing stories. I think that's that's for me that has always been super helpful. But I've really enjoyed just kind of watching everybody nod their heads because it's just been just a reinforcement that so many of the feelings that we're all feeling are real, and they're not just in our heads. The anxieties and the concerns and the confusion about what our restrictions are and not. And anyway, for me, that's been super powerful tonight. But any of the guys have any questions? I feel like the women have kind of taken over the the questions tonight, except for Brian, of course. Any of the guys have anything that they want to chat about? Guess not. Any other questions?
Oh, Thea, let me add this a little bit. The wintertime is kind of rough with the breathing and the cold air. Sometimes the humidity will mess with you too. Depending
Absolutely.
on where you live, if you stay in the DC metropolitan area, when you start talking about 90 and 90%
Yep.
humidity,
Winter and summer, high risks.
just
Winter
make
and
sure you're
summer.
careful.
Yep.
You know,
Yep.
that's how
Sometimes we get that brief spring or brief autumn, but yeah, we live in in terms of environmental stressors, we're right up there. hot, humid summers and cold, damp winters. Yep, you're absolutely right.
You know, I had not I don't think I've noticed that before. Um, with the cold weather until maybe a couple of years now, that when I'm out in the cold weather, that there are times that I find it difficult to breathe. And if I have on a mask, then it's a lot easier.
Mhm.
I don't know that I had noticed that before now. And I was just surprised to hear that tonight, okay, I really need to pay attention to this.
Right. Yeah. And that's kind of the body awareness exercises. The more that you do with breath work and knowing your body, then you can gauge if that's a change in your body or if it's just an environmental response.
Thank you so much.
My pleasure. My pleasure.
You've been a wealth of information. For those of you all who visit, I'm sure she gave you some, I guess, knowledge to really share with some of the patients that you're going to end up visiting. I know she did that for me. Okay, but thank you.
Good night, everyone. Thank you, Marlys.
Thank
Good
you.
night, everyone. Thank you.